Internal Medicine for Semester 6 of the Faculty of Medicine. Internal Medicine. Learning Objectives. Understand the etiology, pathophysiology, diagnosis, and management of diseases commonly found in the field of internal medicine. Be able to approach patients holistically, including anamnesis, physical examination, supporting examinations, diagnosis, and therapy. Understand the principles of evidence-based medicine in the management of systemic diseases. Develop laboratory and radiology result interpretation skills. 1. Cardiovascular system diseases. Main topics: coronary heart disease, CHD, definition. Narrowing of the coronary blood vessels due to atherosclerosis. Main symptoms: angina-type chest pain, with or without spread to the left arm, jaw. Examination: ECG, ST depression or ST elevation. Biomarkers: troponin T, I, CKMB. Management: acute phase, MONA, morphine, oxygen, nitrates, aspirin, reperfusion, PCI, percutaneous coronary intervention, or fibrinolytics. Long-term therapy: statins, beta blockers, antiplatelets. Hypertension. Definition: blood pressure is greater than or equal to 140/90ths of a millimeter of mercury on repeated measurements. Classification: primary, 90 to 95%, versus secondary, renal, endocrine. Management: pharmacological, ACE inhibitors, ARBs, diuretics, CCBs. Non-pharmacological: low-salt diet, exercise, weight control. Heart failure, pathophysiology, inability of the heart to pump blood according to the body's needs. Classification: systolic heart failure, EF less than 40%. Diastolic heart failure, EF greater than 50%. Therapy: diuretics, ACE inhibitors, beta blockers, aldosterone antagonists. 2. Respiratory system diseases. Main topics: pneumonia. Etiology: bacteria, Streptococcus pneumoniae, viruses, fungi. Symptoms: productive cough, fever, shortness of breath. Diagnosis: chest X-ray, infiltrate, sputum culture, procalcitonin. Therapy: antibiotics according to the spectrum, oxygen therapy, hydration. Bronchial asthma. Pathophysiology: chronic inflammation of the airways, right pointing arrow hyperresponsiveness, right pointing arrow bronchoconstriction. Symptoms: wheezing, episodic cough, shortness of breath especially at night. Management: acute, beta-2 agonists, salbutamol. Long-term, inhaled corticosteroids, LABA, long-acting beta agonists. Chronic obstructive pulmonary disease, COPD, etiology, smoking, exposure to pollution. Symptoms: chronic shortness of breath, cough with sputum. Diagnosis: spirometry, FEV1 FVC less than 70%. Therapy: bronchodilators, inhaled corticosteroids, supplemental oxygen. 3. Digestive system diseases. Main topics: gastritis and peptic ulcer. Etiology: Helicobacter pylori infection. Long-term use of NSAIDs. Symptoms: epigastric pain, nausea, vomiting. Diagnosis: endoscopy, rapid urease test, urea breath test. Therapy: proton pump inhibitors, PPIs, H. pylori eradication. Chronic liver disease, cirrhosis, etiology, hepatitis B, C, alcohol, NASH. Symptoms: jaundice, ascites, hematemesis. Diagnosis: SGOT, SGPT, low albumin, high INR, liver ultrasound. Therapy: control complications, diuretics for ascites, beta blockers for esophageal varices. Irritable bowel syndrome, IBS definition: gastrointestinal dysfunction without structural abnormalities. Symptoms: abdominal pain, diarrhea, constipation. Therapy: antispasmodics, low FODMAP diet. 4. Endocrine and metabolic diseases. Main topics: type 2 diabetes mellitus, pathophysiology. Insulin resistance, pancreatic beta cell dysfunction. Diagnosis: fasting blood sugar is greater than or equal to 126 mg per deciliter. HbA1c is greater than or equal to 6.5%. Management: metformin, insulin, if needed, lifestyle changes. Hypothyroidism. Symptoms: fatigue, dry skin, hair loss. Diagnosis: high TSH, low T4. Therapy: levothyroxine. Hyperthyroidism. Symptoms: palpitations, weight loss, tremors. Diagnosis: low TSH, high T3, T4. Therapy: antithyroid, PTU, methimazole, radioactive iodine. 5. Systemic infectious diseases. Main topics: dengue, hemorrhagic fever, DHF, etiology, dengue virus, Aedes aegypti. Symptoms: high fever, thrombocytopenia, hemoconcentration. Diagnosis: NS1 antigen, dengue IgM, IG. Therapy: intravenous fluids, antipyretics. Pulmonary tuberculosis. Symptoms: chronic cough greater than 2 weeks, fever, night sweats. Diagnosis: AFB sputum, chest X-ray. Therapy: OAT, isoniazid, rifampicin, pyrazinamide, ethambutol. 6. Clinical case study and integration. Case study: real patient-based discussion for diagnostic and therapeutic approach practice. Physical examination practice. Cardiovascular, respiratory, digestive, and other systems. Interpretation of supporting examinations. ECG, chest X-ray, CT scan, laboratory results. Additional diagrams and tables. Normal value table. Fasting blood sugar less than 100 milligrams per deciliter. Blood pressure less than 120/80ths of a millimeter of mercury. GFR greater than 90 milliliters per minute, 1.73 square meters. Flowchart example. CHD diagnosis flow. Chest pain, right pointing arrow. ECG, right pointing arrow. Biomarker, right pointing arrow. Angiography.